Well, Rebekah, I want to thank you for joining me today. I know your time's valuable. It's great to touch base with you again. It's been a while, I know. But I just wanted you to share with us what you've been doing since I last saw you and where you are and where you're going.
Yeah, of course. Yeah, thanks for inviting me. This is exciting. I actually just finished my medical residency in family medicine about a month ago. So just a little bit about my path until I got here. After college, I took a year off because I was trying to decide between PA and medical school. I ended up going to medical school at ETSU, Quillen College of Medicine, which was great. Between my third and fourth year, I also did a master's of public health in Washington, D.C. at George Washington University. And then I decided to do family medicine with an emphasis in family planning and women's health. And so for that purpose, I came up here to Boston, which is where I'm at now, to do family medicine residency here. And my program at Tufts offered a lot in regards to full spectrum women's health, which is something I was interested in, and then also a big emphasis on public health. So I've had a great experience. I am getting ready to start my next job, actually. I'm doing a lot of different things. So I will be my full-time job that I'll be getting paid for. I'll be working as a hospitalist physician, which is just inpatient medicine at one of the few actually publicly funded hospitals here in Massachusetts. We serve largely an immigrant population, a lot of people who speak Portuguese, Haitian Creole, Arabic, Spanish, lots of other languages. So it's really like a great mission-based hospital. It's Harvard affiliated. So I do a lot in regards to working with public health and primary care people at Harvard, Boston University. And I'm actually going to also be a visiting scholar at Northeastern University this fall, and actually for the year. And then just also in addition to that, I have launched an organization with my fiance where we advocate for policies and political candidates that are really focused on health equity and the social determinants of health, since that is what is really at the core of what makes people healthy in our society and is really apparent now during COVID, and then also just within primary care. So that's a bit about what I'm doing now. I'm here in Boston for the time being.
Full plate.
Yeah.
Full plate. I wouldn't have expected anything less. Well, I know that when you were in high school, you participated in the health science courses, and you also were a member of HOSA. And I just wanted you to share a little bit about your experiences and how you think that may have been important to you.
Yeah, of course. So I actually met one of my best friends still to this day on my first day of 9th grade in your class. And so I was in HOSA from 9th through 12th grade, and then I competed in the events from 10th through 12th grade. In 10th grade, I was in a communications team event, and then 11th and 12th grade, I did medical terminology and went to the state competitions, which was such a great experience. So I think in general, just actually having the medical background from high school is something that's pretty unique, which is what I've found, especially as I talk to my colleagues, my friends, even people outside of medicine. It's a pretty unique and beneficial experience to have had that. And so I think it actually gave me a great introduction. Even when I started just say anatomy and physiology in college, I already felt like I knew a lot more, had a really good foundation for those things that I'd learned in high school. And then this is a little bit separate from HOSA, but more to the medical classes. So I got my CNA license through Science Hill from taking the medical classes. And I actually worked as a CNA for some time in college. And that was just such a valuable experience. It's very hard work, but it's
Yes.
such a valuable experience to be able to work with patients in that way, to learn more about the medical system, and to really have a good, like a really solid appreciation for CNAs, because I mean, it's so much harder work than what I do now, to be honest. And I think it was just such a good experience to be able to work at like doing different things within medicine. And then, I mean, so HOSA itself, the opportunity to compete in these different events also gives you a good foundation for for like so many things you'll do in medicine. The events are really applicable. Sorry. Are really applicable to what you study in college, what you study beyond, whether you pursue like master's or doctoral degree. So I think it's really great for knowledge and foundation, and then building these experiences. And then I mean, actually, some of my best friends still to this day are people that I was in HOSA with. So I think that's great.
Great. Well, what would be your advice to somebody that's really interested in the healthcare profession?
Yeah, so I think getting involved in the medical classes, taking as many as you can, and then also getting involved with HOSA. I was quick to sign up for the medical classes, but I was, I guess, just a little nervous initially about HOSA, because you like have to, well, you often compete and you travel to these events, but it was just so cool, like getting involved and then starting to get to know people within the HOSA community. You get to know other people at your own school really well, people who are interested in your path. And it's great because I think you also really form connections and relationships with people who are going to do a number of things within the medical or like social science fields. So I think just really taking as many of the classes as you can, the medical classes. I would really highly recommend trying to get your CNA license if that's still a class at Science Hill, and then getting involved with HOSA. And I think you really do get the most out of HOSA when you go to the events, when you sign up for an event that you're going to compete in, and work towards that. So those are my best recommendations.
You know, HOSA really serves as a pipeline to the healthcare community, and the mission is to empower people to become leaders in the global health community. And Gal, I see you doing it.
Thank you.